Gout is an inflammatory arthritis that occurs when uric acid, a breakdown product of proteins, precipitates into the joint, causing a painful inflammatory joint reaction. Gout can occur in any joint in the body and frequently occurs in the foot and ankle. The most common location in the foot is the first metatarsal phalangeal joint or the big toe joint. 90% of the time, gout results from underexcretion of uric acid through the kidneys, while the other 10% of the time, gout results from overproduction of uric acid. There is a genetic predisposition to gout, and therefore knowing your family history is important. Foods rich in purines, including seafood and meats, as well as alcohol, frequently trigger gouty attacks. Gouty attacks frequently occur in the acute setting. Commonly, patients will go to bed at night without any pain and will wake up the next morning with severe pain, redness, swelling, warmth, and difficulty walking. Taking a thorough history is important as gout is frequently misdiagnosed as an infection. Gout is generally diagnosed by a thorough physical exam in combination with urinalysis, blood work, X-ray evaluation, and evaluation of joint fluid to look for gouty crystals. When patients present with gout, the acute symptoms need to be addressed first. Treatment for acute gout includes steroid injections, oral steroids, anti-inflammatory medications, rest, ice, and elevation. Once the acute symptoms of gout are addressed, the goal is to prevent recurrent attacks, as chronic gout can cause severe joint destruction, leading to long-term pain and disability. The cause of gout, that is overproduction versus underexcretion, must be determined to guide treatment, and this is completed by urinalysis and blood work. Long-term treatment includes medications and following a gout-friendly diet and lowering alcohol consumption, particularly beer. If you're experiencing any of these symptoms, please call the Timonium Foot and Ankle Center today to schedule an appointment.